Hi guys, welcome back. In this video we shall be talking about mucomycosis, which is very much seen nowadays with the association with COVID-19. Mucomycosis is called as black fungus. Please try to understand there is no word actually calling it as black fungus. It is actually known as mucomycosis. Now this black fungus infection, whenever you're saying you're having a black fungus infection, whenever you're having mucomycosis, you will be having a black kind of patch around your nose or around your eyes. So it is in black in color, right? And it is known as, it is caused by the fungus. That is the reason a common man tells it is a black fungus, but it is actually called as mucomycosis, right? Now what is this mucomycosis? As I told you, it is a fungal infection caused by spores. Now what are these spores? Any organism, they try to survive in the environment, in your body or in environment. It makes a hard capsule around its structure so as to resist the surrounding harsh environment, right? So same thing happens in this mucomycosis. It is made up of spores. So these spores are present all over the surface. It is present in your soil, sometimes it can be present in your food, it can be present in the air, it can be present in your construction sites, right? It can be present floating in the air. So whenever you inhale the spores, the root of infection is inhalation. Whenever you inhale the spores, this will go and deposit in your respiratory tract. Now remember, these spores are antigen. This means it is a foreign body to the body. It will come and attack this antigen. What will come? It is your antibodies will come and attack. Your WBC will come and attack this fungal infection. Please try to understand, every day you are inhaling a huge number of spores, huge number of spores every day, and that is absolutely normal. Your body is designed, well equipped in order to fight this kind of infection, right? You don't have to worry about this. The problem comes here whenever you're having COVID-19 or you're having some immunocompromised state. I'll tell you what happens whenever you inhale this spore. It goes and deposits. So your WBC, your macrophage, your neutrophil comes and eats up this the fungal infection, eats up the spores, right? So your body neutralizes the infection. Now imagine you are having COVID-19. Please try to understand, whenever you are having COVID-19 itself is a risk factor for developing of mucomycosis. Now whenever you are having COVID-19, there is a specific immunity, specific WBC, that is known as the neutrophil. This neutrophil count, it reduces. Whenever your neutrophil count reduces, your ability of your body to fight this infection is reduced. So you are having this chance of developing this infection, right? Along with this, whenever you're having COVID-19, remember, whenever you're having COVID-19, it slowly attacks your pancreas. So if your pancreas has been attacked, there is no insulin production in your body. So your sugar level rises. Please try to understand, whenever you are having diabetes mellitus, rather also you're having uncontrolled diabetes mellitus, your immune system is not working optimally. So your neutrophil count is not working optimally. So if you're having diabetes mellitus, you're having more chance of developing this mucomycosis. This is a kind of opportunistic infection. Opportunistic infection means this infection is always ready to attack you, but your immune system is quite well enough to fight with this, so your body is fighting against it. Anytime your immune system goes down, it gets an opportunity and it will come and attack you. So that is the reason it is known as opportunistic infection, right? So whenever you're having mucomycosis, it can either affect your face area or it can affect your lungs area. Okay, so if it affects your lungs area, it will cause you pulmonary mucomycosis, and if it affects your facial area, it can affect your sinuses, it can affect your nose, it can affect your eyes. So in this, if it is attacking your face, we are telling this as this rhino-orbital cerebral mucomycosis, right? Rhino means nose, it is attacking your nose. Okay, orbital means behind the eyes and the eye surroundings, and cerebral means a part of the brain. Why it will affect the part of the brain? If it is affecting your eyes, it can go via the optic nerve to the brain. So that is the reason you have seen that why a person is having a fungal infection, mucomycosis, they have to be removed their eyes because of this, because we don't want this infection to go and spread to your brains, right? So if it is affecting your face, it's dangerous. If it is affecting your chest, it's dangerous, right? So how do you know that you are having some symptoms of mucomycosis if it is affecting your face? you will be having blocked nose, right? You'll be having blocked nose, or you'll be having discharge coming out from your nose. It can be of varying color. It can be green in color, it can be red in color, right? You will be having pain in your eyes, or you'll be having headache, right? These are the symptoms that you know that you're having fungal infection in your face. If it affects your chest, you'll be having chest pain, you'll be having fever, you'll be having cough, or you'll be having cough with blood. So these are the symptoms that you know that you are going to have a fungal infection. So try to understand, why are you developing the fungal infection in the first place. As I told you, COVID-19 itself is a risk factor. COVID-19 will cause you damage to your pancreas, your insulin level will not be produced, so your blood sugar will go up. Again, it will be making a problem worse. If you're having diabetes mellitus, and you don't control your diabetes mellitus properly, your immune system is not able to work. Problem again. Remember, whenever you're having COVID-19, there's a treatment that we are giving is corticosteroids, because in initial phases of the infection of COVID-19, your virus is actually replicating. It is actually replicating. That time you are not supposed to take corticosteroids, right? But once it goes in moderate stage, at that time the replication process of the virus is reduced, and then it is causing something known as cytokine storm. In very simple words, your immune system is fighting with the coronavirus, right? So it is causing a lot of collateral damage. So there's a lot of inflammation going around your body. So this actually produces adverse effect. So to counter this, the adverse effect, to reduce inflammation, we are giving you corticosteroids. But you have to understand, corticosteroid is a very, very, very good drug, but at the same time, it's a very dangerous drug at the same time. Any inflammation in the body will be reduced by corticosteroids, but remember, whenever you are giving corticosteroid, it increases your blood sugar level and it reduces the immune system. You see, increasing your blood sugar level will making you developing diabetes mellitus, making your immune system to work less. At the same time, corticosteroids will be making your immune system work less. So you are having a chance of opportunistic infection. So that's the reason, if you're seeing a patient who is taking corticosteroids, they can have this infection. The main reason of this corticosteroid is wrong dose. That means if you're taking more than required dose and you're taking it for more long as prescribed, these are the main two cause why this corticosteroid is causing this fungal infection. Along with this, if you're having a cancer patient, you have been given chemotherapy, your immune system is working suboptimally, right? It will cause you again chance of developing fungal infection. Along with this, if you're having long chronic disease means again your immune system is not working properly. Along with this, if you are a patient of organ transplant, we are giving you immunosuppressive drugs in order to avoid the rejection. Then also you're having this opportunistic infection. So you see, COVID-19 is a very vicious cycle. We need to give you corticosteroids, but this corticosteroid itself can cause you mucomicrosis, right? So please try to understand, there are some studies that still needs to do more studies. There are some questions that even if you're having rheumatic arthritis, we are giving you corticosteroids for a very long time, but you never saw such a huge surge that a person who are taking corticosteroids, they had mucomicrosis. So it depends. The chances are that because of the corticosteroids, you're having mucomicrosis. Because of COVID-19 infection as well, your neutrophil count is going down. Because of COVID-19, your diabetes is not very well controlled. Because of COVID-19, your insulin has been damaged. Because of the pancreas, it's been damaged. So there is a not very clear-cut answer that why we are able to see a huge number of fungal infection in this COVID-19. Yes, the chances are because of this COVID-19 or the corticosteroid use, but more studies has to be made in order to make a clear-cut diagnosis that okay, this is the cause of this fungal infection, right? So how do you prevent this fungal infection? Very, very simple. Whenever you're using a mask, please make sure that masks are very clean. It's hygienic. Hand washing is very important. Please try to see that your blood sugar level is under control. If you are having diabetes mellitus and you are taking corticosteroid, you have to make sure that your diabetes is controlled very properly, because if you're taking corticosteroid, your blood sugar will be up. So you have to increase your blood if you're taking insulin, your insulin level has to be increased. Or if you're taking metformin, that is something a tablet to take control your blood sugar level, you have to increase the blood sugar level, these medication dose. So please talk to your doctors that there has to be dose modification done. Along with this, if you're given a corticosteroid, please take the exact dose of the corticosteroid and for the exact amount of time. Please do not increase the dose yourself, or please do not increase the duration of dose of the corticosteroid. Please talk to your physician. Please talk to your medical doctor, because this is the reason you don't want to do self-medication. It can cause a serious adverse effect. Again, I tell you, corticosteroid is an amazing drug, but if you make the timing wrong of the period of this COVID-19, it can actually cause you more harm than good, because studies have shown that if you're taking corticosteroid in mild kind of illness, the side effects are more than the benefits, right? So please try to understand corticosteroids is very, very dangerous, but at the same time it's very good drugs. Sometimes if you don't know what is actually happening, you give corticosteroid, it is most likely going to help, right? So remember, this fungal infection will be more likely to be seen in patients who are having diabetes mellitus, uncontrolled diabetes mellitus, who are having low immune state, either taking corticosteroids, or they're taking immunosuppressive drugs, or they're in chemotherapy, or organ transplant, or long systemic disease, or they're having COVID-19 itself, or they're having HIV also. And those people, they are more likely to develop this fungal infection, right? It is, again I'll tell you, it is known as mucomycosis, right? So that's all for now. I hope you can take good care of yourself. Please don't be panicking, and at the same time there are some very good treatment for this. There are antifungal treatments, but due to the shortage of these drugs and there's a huge surge of this infection, there is sometimes a lot of deficiency of this medication. So there are people who are doing panic buying. Please don't do this panic buying. There are some people who actually need this medication more than you, right? So that is very, very important. So those are the things that I wanted to tell you. And again, I want to tell you, there has to be some more studies to be done, that is actually COVID-19 or the corticosteroid directly associated with mucomycosis, because corticosteroids has been used for a long time in other diseases, but we didn't see it to a very great extent. Yes, we saw some mucomycosis infection, this fungal infection, in previous history of Mars, but there has to be done a lot of studies now, and I'll try to make more upcoming videos about this infection. More research has to be done in order to make sure that this is directly associated with corticosteroids, right? Again, for the last thing, I like to say that please try to understand the clinical features. You'll be having facial pain, you'll be having pain in this area, you'll be having nasal blockage, you'll be having nasal discharge, you'll be having blood coming out, or green color thing coming on, you'll be having pain in your eyes, you'll be having headache, right? If it attacking your facial area, if it is attacking your lungs area, you'll be having chest pain, you'll be having cough, you'll be having fever, you will be having cough that is mixed with blood. So these are the symptoms that you have to watch out very aggressively. Any of the symptoms are there, immediately rush to your hospital, and please talk to your doctor and follow the advice given by the doctor. Please do not self-medicate by looking into a video or looking into online resources or to any other websites. There are a lot of things that has to be kept into account whenever we are giving you medication. Go and meet your own professional physician, right? Medical doctor, you have to go and meet. So that's all for now about this video. I hope you can find this helpful, and that's all for now. Stay safe. Thank you.